Hey everyone, welcome to the Freedom to Flourish podcast. I'm Dr. Joel Miller here with my awesome friend, awesome colleague, Dr. Tim Augustiniak. Today we're talking about endometriosis. We've had different episodes in the past talking about regulating your cycle and balancing hormones for the women and also for the guys. And we've even had a specific episode on PCOS, but we haven't had a specific episode on endometriosis. And so our goals for this episode is to really talk about what it is, kind of talk about, hey, if you are having these issues, obviously some women at this point that are listening to this, Dr. Tim, they already have been diagnosed. But really we want to look at it from a big perspective. So like, what is endometriosis? Let's talk about the symptoms briefly. We'll talk about how do you diagnose this from kind of the medical perspective, but then also kind of from the holistic perspective. We'll talk about the cause, what your medical doctor or endocrinologist is going to say is the cause, and then what we really find to be the cause, a little foreshadowing there. And then we're going to get into obviously diagnosing it. And then the most important thing, and this is where I want to spend most of our time, Dr. Tim, is how do we reverse this issue? And one question we may even throw up is like, hey, is this a quote unquote curable condition? Is this something that you can reverse? And we're going to talk about that because we would strongly disagree with most doctors in that. And so we're going to spend hopefully more time talking about the solution and how you fix these things. Dr. Tim, I'm so glad you're here. I think that, we were talking about this just a little bit before. We've had a number of patients that come in with these issues, and we've been able to help women significantly to, number one, actually reverse these issues. Number two, to be able to get pregnant, to not have pain with intercourse with their spouse, to not have painful, dreadful cycles and periods every month, and to actually have regular periods. To the person that's listening that's been diagnosed with endometriosis or might think that they have it, hopefully this episode will be a little bit more clear for you, but hopefully it'll be hopeful and it'll actually give you direction and guidance as to what you actually need to do for this. There's so much reason to have hope. So I'm excited. Dr. Tim, that's a long-winded intro. I'm glad you're here. Let's jump into this a little bit. How's everything going today? And let's kind of jump into endometriosis.
Yeah, things are going good. Happy to be here. This is going to be a good episode. This is always something that, female hormones and the issues that revolve around that are some of the most common things that we'll see. Whether a lady comes in for gut issues, immune system issues, migraines, pain, you name it, typically there is some degree of hormone involvement. I would argue that just about every single woman that comes into the office, they have some sort of hormone issue. It's just a matter of how it's manifesting and how severe it is. Now, with women who have endometriosis, usually that's the first thing on their list when they come on in. It's not like they're going to have some other issue that trumps this. Typically, if a woman has endometriosis, that is probably the most provocative, most irritating, most severe problem that they have, because it can be difficult to manage sometimes. But the goal of this episode is hopefully just shed some light on how we treat it, how you can calm it down on your own, some dietary things that you can do, supplements you can take, all the things that go into the pathophysiology of endometriosis and how to fix it naturally. Of course, with all the things that we talk about, there are certain conditions where we go, okay, well, this is something that you can absolutely reverse and treat and do all these things naturally. I would argue that with endometriosis, if you have significant endometrial tissue that is growing outside of the uterus, in like the ovaries, fallopian tubes, bladder, gut, you name it, all that stuff. Whenever it is a pretty significant severe case of endometriosis, there's honestly not an insane amount of things that you can do to help that tissue that's overgrown. It's not like you can just take some supplements and all of a sudden this tissue is going to be reabsorbed and break down and all that stuff. However, there's a lot that you can do to calm the severe symptoms that come along with it. But this is a condition where I think co-management with the medical side can be very, very, very beneficial. I've had plenty of patients where they go in and get an ablation and they get surgery to get this extra tissue removed. And then once we get past that and heal them up from it, what we can do is make sure that we deal with the underlying hormone issues, blood sugar issues, inflammatory issues that contribute to the susceptibility for it to come back in the future. Because something to emphasize with this condition is if you do not handle your blood sugar, if you don't handle your hormones, if you don't handle your inflammation, this is something that will come back, even if you go the medical route, get surgery and all that stuff. And if you take birth control, it's just kind of slapping a Band-Aid on it. If you're truly trying to fix things, you got to deal with things by making some lifestyle changes. The end. So, but anyway, I'll, give you a rebuttal to your long intro by also giving a long intro. But in a nutshell, endometriosis is a tissue where your endometrial tissue, which is the lining of the uterus, that same tissue grows not only really thick within the uterus, but also it can grow outside of the uterus through all those tissues that I mentioned previously: ovaries, fallopian tubes, bladder, your large, small intestine, all that stuff, and then the pelvic lining. So you can get all these adhesions in there that get really inflamed and irritated, especially every single month of your cycle. Also, it can be irritated with ovulation. Anytime there's a spike of estrogen, it can really be problematic. So, Dr. Joel, why don't you walk us through symptoms and things that women may experience when they have these problems?
Yep. So if you go into your doctor and you're complaining of different hormone-related symptoms because of endometriosis, or if you know you have endometriosis, here's probably your symptoms. So pelvic pain, especially when you're around your period, dysmenorrhea, which is essentially, dyspareunia is where I wanted to start first, which is essentially painful intercourse. The heavy bleeding, infertility is a big deal. And then, of course, the dysmenorrhea, which is, I kind of mentioned that, but that's your pain with your periods. The other PMS symptoms are also super, super common, right? So, leading up to your period, tender breasts, headaches, migraines, irritability, even depression. All these things are super, super common with endometriosis. So the next question is, how do you diagnose this? So we're going to kind of compare and contrast this a little bit, right? From the medical perspective. So the first thing that your doctor should be kind of asking about and looking for is the different symptoms. So taking a good history, asking about the symptoms. Are you experiencing the things that we just mentioned? An ultrasound or MRI is usually recommended as kind of the first line there, even though the gold standard is technically a laparoscopy, where they take a camera intravaginally and kind of look around at the uterus and the uterine lining. But the ultrasound and MRI is actually going to show you more of the pelvic cavity and the intestines, and if there are different growths in those different areas. Regardless, they can both be helpful. Dr. Tim, anything to add to that? Otherwise, let's kind of jump into like the cause and the solution for this from a medical perspective, and then we'll come back to some of the kind of our holistic approach here.
Yes, the last thing that I would add to that is just really emphasizing that the variation of symptoms that women can experience this condition is pretty wide. Of all diagnoses, I would argue that endometriosis can be relatively minor, where you just get a little bit of thickening of the endometrial lining, therefore a bit more heavier, crampier periods. Or it can be all the way to the other end of the extreme, where there's significant severe pelvic pain. I've had women where they almost feel like they're going to pass out, get really dizzy, vomiting, all that stuff in response to endometriosis. And so it can be really minor, it can be really extreme, it can be all centered around your period, it can be all centered around infertility, it can be all over the place. And whenever you get symptoms, it can be completely different from, some other woman that's walking down the street that has the same thing. But the things that will drive it are very, very similar. So we're going to get into all those things. But let's get into how to diagnose it. I'd love to hear your take on this, but there are underlying genetic things or markers that will be involved with endometriosis. There's some correlation there. So in patients who have endometriosis, there are some genetic markers that may be positive. However, there is not necessarily any steadfast genetic screening or one gene that's going to say, hey, you absolutely are going to get endometriosis. That is not necessarily how this condition works. There's always the argument of epigenetics and all that stuff and how it plays into it, but we'll get into that in a little bit. As far as it goes for actually diagnosing, at least from the medical side, at least with us in the office, we're not going to definitively diagnose you with endometriosis. By the time you would come see us in the office, you've got a diagnosis of endometriosis. You've already, been the route of, okay, I don't want to do birth control. I don't want to do surgery. I don't want to do this. I don't want to do that. Let's go about it naturally. So in order to get that diagnosis in the first place, going to your OB, GYN, your primary care, all that stuff, you'll probably end up being funneled just back to your OB/GYN. And they'll take you through things like maybe ultrasound, MRI, laparoscopy, to identify exactly what's going on there. But also, just like any other hormone centered diagnosis, like PCOS, endometriosis, things like that, there's a lot of symptoms that go into it too. And so in order to be diagnosed with things, symptoms of dysmenorrhea, painful intercourse, very, very heavy bleeding, very heavy clotting during bleeding, infertility, all of those things would be described as symptoms of endometriosis. And so if you have a whole lot of symptoms that align with it, a lot of times, if you meet enough of those criteria, they're not even going to order testing for you to get an ultrasound, MRI, things like that, because it's not even cost effective at that point. If it's an estrogen dominant issue, and say, your OB is just truly just medical things, doesn't really care about diet change, all that stuff, they're probably just going to put you on birth control anyway. Yep. So at what point is it even worth it for them to run it through insurance to pay for an ultrasound, MRI, things like that, confirm something that signs and symptoms already align with and confirm to a very statistically significant degree? Kind of with that. I mean, I understand, a big goal of what I think should be a thing is reducing medical costs, but I don't think that should be at the expense of proper diagnostics and treatment. So I'll hold my tongue as to what I think in this circumstance, whether or not that's necessary, because I don't order that stuff to diagnose this. But oftentimes that'll be the case. So anyway, what's your take?
So,
Dr.
So one of the things that you're kind of communicating occasionally here is that with something like endometriosis, there can be kind of a wide range of severity, I guess, is what we're getting at, right? So like you mentioned, some people, they have this endometriosis issue and they have significant symptoms and problems. Some women just have pain and cramping and things like that. And then also, I think we could also say that the overall, severity with, that we might see with testing is also going to be very different. So it's like you're saying, if we, most doctors are going to kind of look at the symptoms, and what they probably should do is recommend an ultrasound or MRI to kind of check things in the severity. And then for the gold standard diagnosis, do the laparoscopy. But most doctors are kind of looking at it, they're like, hey, it sounds like a hormonal imbalance, which, Dr. Tim, I would say, I think most doctors use endometriosis as a catch-all. It's like, hey, we see this hormone imbalance, pain with your period, endometriosis. And if they have if the women have excess hair growth, and other like androgenic male symptoms, then it's probably more like, oh, you probably have PCOS. You probably have cysts on your ovaries and that kind of thing. So a lot of the symptoms are the same, but I definitely would agree. I feel like doctors will use it as a catch-all. So let's say you're going to a traditional doctor or an endocrinologist, and maybe they're, they're doing a little more thorough job, which they, probably should. But let's say we ask, hey, what's the cause of this? Let's say you've got the diagnosis. What's the cause, doctor? Most of the time, they're going to give this kind of response of, hey, it's not really fully understood. There can be genetics, there can be hormones, there can be environment stuff, there can be immune system stuff. But in reality, which with a lot of conditions, Dr. Tim, most doctors are like, hey, we don't really know. And that's obviously pretty crummy, nobody likes to hear that. And, if you don't really know what's causing it, how do you know how to treat it? And so we're going to talk about the, answers I think people are going to find very helpful in just a few minutes here. But, the solution, like you mentioned, most of the time doctors are recommending birth control, progestins, other different hormonal therapy, in which case with birth control, you're adding in synthetic estrogens to the body, which are going to cause you're basically going to override your hormonal regulation system. And that's going to cause your body to stop producing as much estrogen. Now, obviously, the downside of that is you're not really going to be able to get pregnant. Another downside is you're not really actually fixing the issue. And then, there can be a lot of side effects from birth control and things like that. Whether you're using the pill or the IUD, there's rough side effects with all of them, whether it's different vitamin deficiencies or just issues with the nervous system, all that stuff. Doctors will usually recommend NSAIDs. Sometimes it's just like, hey, when you have pain, just take some ibuprofen. And it's like, okay, that's clearly not actually fixing the issue. And then you have surgery, which I think most women will go towards when it's a really bad issue. And the problem with surgery that we would say is, you can do the ablation and you can get rid of those tissues. You can cut them out, all these different things, the excessive endometrial growth. But as we were talking about, Dr. Tim, we talk about this all the time with hormone issues and in conditions in general, is just because you remove whatever is grown doesn't mean you're actually helping the body to heal itself or allowing the body to heal itself. All you're kind of doing is removing this thing. And so this kind of takes us, I'm going to use this to kind of segue us, Dr. Tim, into getting into the good stuff. So let's talk about, like, how do we diagnose this? We already talked about it briefly, but talking about the cause and then how we fix these things. So number one with the diagnosis, obviously from our signs and symptoms, Dr. Tim, when we're working with people, we can easily point, hey, this looks like it could be endometriosis. And the big term that we're going to get into is estrogen dominance. When women have issues with their period, irregular periods, heavy bleeding, all these different things, they're likely dealing with estrogen dominance, which we're going to talk about more in detail in a second. But if you, for my patients at least, if they want a for sure diagnosis, I'll usually recommend either an ultrasound or an MRI. And what that does is it gives us just a big picture of, like, hey, how bad is this issue? Is this endometriosis, and how bad is this issue? And, when we have that kind of baseline, that's really helpful, because as we start addressing things and we're expecting that things are going to start, essentially reversing and possibly even shrinking these things, we want to be able to see that progress and so forth. So that's usually my approach with things, is I'll usually recommend like an MRI or ultrasound at some point, just to get kind of the full picture and baseline on that. Anything else? I know you talked about it a little bit. Anything else you would add to that from our diagnosed perspective? I know one thing we haven't talked about really with is maybe the lab testing, or how we might diagnose this thing called estrogen dominance. Anything else to add? Otherwise, maybe can you help us explain what estrogen dominance is, how we find this issue and how bad it is, and then we'll get into fixing these things.
Yeah. So what estrogen dominance is, it's basically just a relatively high estrogen compared to progesterone. So if you think of, baseline, everything should be somewhat equal. Of course, the units of estrogen versus progesterone in our body isn't necessarily equal.
Not necessarily the same. Yeah.
Yeah, it's the proportions that your body is happy with. We'll put it that way.
Sure.
And typically what will happen with estrogen dominance is, it's not like your body just produces too much estrogen and you don't have enough progesterone. Typically you'll have normal progesterone, at least in the short term. And then from there, you won't detoxify estrogens properly. And so what will lead to that down the road? Methylation issues, chronic histamine issues, chronic caffeine use, all the things that are going to deplete your methyl donors to help prepackage your estrogen, then be detoxified through their individual hormone detox pathways. So the three detox pathways that estrogens are detoxified through are glutathione conjugation, sulfation, and glucuronidation. So we've talked about this before. If you want to revisit our PCOS episode or just our female hormone episode, we talk about all that stuff more. And any of the episodes that we talk about blood sugar and liver issues, all that stuff, it all comes up in there as well. But so these three hormone detox pathways have overlap between estrogens, testosterone, cortisol, all that stuff. So all of our steroid hormones will detoxify through these same pathways. So with that being the case, if you have too much cortisol, for example, or if you have too much testosterone and you're depleting your resources to detoxify any of those, excuse me, you're going to deplete your resources to detoxify estrogens. And so with chronic blood sugar blood sugar issues and chronic stress and chronic depleting those resources through stress and all that stuff, you're going to inherently put yourself at a greater likelihood, or you'll have greater odds of developing endometriosis, or at least at developing estrogen dominance. So estrogen dominance can be due to normal progesterone, relatively high estrogen due to poor detoxification in the liver. Or what you can have is, say you are fatigued as far as your adrenals go. So you're stripping all of your body's resources to make steroid hormones by running your adrenals into the ground. So cortisol has a common root in cholesterol, the same as estrogen and testosterone, all those hormones do as well. Same with progesterone. So you're producing too much stress for too long. At some point, that battery that your body keeps nice and filled up to produce steroid hormones with will become dirt. And when that's the case, you can get where whatever progesterone you do produce is going to push towards estrogen to keep it at a regular level. However, progesterone, there's nothing holding anything back to progesterone. If your body wants to produce estrogens and clear hormones, you're going to have relatively low progesterone. So think of it like this. You have normal in quotes, estrogen, and then from there you have relatively low progesterone. And so when that's the case, you'll have relative estrogen dominance. And so you can experience estrogen dominant symptoms due to low progesterone. And a lot of times when I explain things to patients, I will use estrogen dominance and progesterone deficiency somewhat interchangeably, depending on what they're dealing with and what we're working through, especially with how things will test within the muscle testing and the systems healthcare technique that we utilize in the office. Because there's a certain cadence and there's a certain timing that most patients will have when it comes to presenting with these issues. It's just a matter of what's the proper way to go about fixing it. Is it detoxification of hormones, or is it helping the body produce hormones? And so it all depends on what you're really aiming at and at what point of care that those patients are in. So anyway, that is estrogen dominance. Another thing that I like to add with this is everything in our body has something that we call a half-life. So anything that you say, like you take a medication, however long it takes for the medication to, I guess its quantity within your blood or whatever tissue you're measuring to decrease by half is called a half-life. And so however much time it gets to a point where it's no longer effective and causing any sort of issues in your body is the appropriate time that is measured to, without a reasonable or within a reasonable confirmation, say that your body has detoxified whatever substance that it's been given, or that it's been, that it's produced, yada, yada, whatever. So say you take a medication and then a day later it's reduced by half, and then another day later half of that is reduced by half, and so on and so forth. At whatever point, however many days later, it is at a point where your body no longer has any sort of effect from it. That is the appropriate time that your body will, I guess, have to detoxify it. The same thing kind of goes with estrogens and other hormones, and just anything in our body that can be seen as toxic if there's too much. Maybe toxic isn't the right word, but having some sort of symptom due to there being too much. So caffeine's on that list. Histamines are on that list. All of these things are on that list. And so with estrogens, you can also have perceived estrogen dominance, where say your estrogens aren't necessarily high and say progesterone isn't really all that low, but if all of those estrogens are hanging out in circulation way too long and your tissues just aren't clearing them because there's too much of a concentration going on where the liver can't detoxify it and it lacks resources to do so, you can have estrogen dominant symptoms that various lab testing like blood or urine testing might not necessarily just show hormone imbalance. And that's where you and I both, Dr. Joel, we take a totally different approach than most functional medicine doctors, because we use applied kinesiology along with our diagnostic process. It's not just this is what your labs say, this is what we're going to do. There are various signs and symptoms that go along with treating things and identifying what's going on. But then from there, we use the muscle testing to figure out, okay, well, I know your lab said that estrogens were relatively low, but you're still testing as those being a problem. And therefore, that means that your body lacks the resources to detoxify these things. And if that ends up being the case, you can have symptoms where you have heavy, crampier periods, shorter cycles, longer periods, all that stuff. And it's all a factor of how your body is sensing things and how sensitive it is. I really don't think that sensitivity to estrogens is talked about nearly enough in the same way that like insulin resistance, stuff like that. This is, I don't know if I've ever heard any big names in functional medicine like Mark Hyman or Andrew Huberman and just all these docs that are more natural in how they treat things that are just in the mainstream these days. I don't know if I've ever heard any docs actually talking about how sensitive the body can be to hormones that it produces on its own, and what we can do to maximize that sensitivity, or in some instances reduce it. Because in this situation, I would argue reducing it would be necessary. So anyway,
that's great.
I know it's kind of but I'd love to hear your thoughts on that. I know we haven't talked about it before.
Yeah, well, no, that's great. And I love that you mentioned that too, right? So doing the labs, which I'll talk about labs in just a second as far as what that looks like. Most doctors aren't really going to run a lot of labs to check hormones, but we do quite a bit more in the holistic world. But then adding in with the labs, the muscle testing that we do with our patients is huge to get that full picture. Because just like you alluded to, I'm going to emphasize that you can have, I've had this before where patients have the labs the hormones are actually on the lower side. But when we muscle test, we find, hey, there's some kind of estrogen toxicity. And that's basically what I'm finding there is that they're not detoxing it well. And so it's circulating and that's causing other issues. And a lot of times when we support that detoxing, it doesn't cause their hormones to go low per se. But what it does is it actually starts getting rid of most of their symptoms with just supporting the detox of those circulating estrogens. So that's super important. Dr. Tim, when it comes to testing, right? So we talked about diagnosing from a holistic perspective. Of course, we're going to talk through the symptoms, what's actually going on. A lot of times from just the symptomatology, you can kind of narrow it down to, hey, this is probably endometriosis. It could be PCOS, that kind of thing. But then we'll look at lab testing, right? So you can do blood tests, in which case, if you check blood, if you check estrogen, like estradiol, if you check progesterone, if you check testosterone, all these guys, you generally want to check them roughly, I believe it's roughly 5 days after ovulation to kind of get the best picture with things. But one test that we'll usually do more so is called the Dutch test. So the Dutch test, just spelled DUTCH, is it's the most comprehensive hormone test that I know of as far as lab testing goes, that will measure out every single hormone for you. And so occasionally I'll do that with patients that just want to get numbers on things. They want to see where everything's at. Even if from the symptoms I can kind of point and know, hey, that's definitely dealing with estrogen dominance, probably dealing with endometriosis. But then we'll run these tests to get an idea of where these numbers are at. But ultimately, where we're going with things is the muscle testing, because that's where we're going to actually be able to test not only, number one, what's going on with estrogen, what do we need to do to detox it and to support it specifically. Rather than just kind of guessing and throwing different supplements at it, we can actually figure out what nutrients are needed. And then number three, which I would say probably arguably most important for long-term health and long-term solutions, is what's actually causing this increase in estrogen or this depletion of progesterone. And we can jump into all that stuff with the muscle testing and really get accurate and specific with things. So let's kind of jump into let's check if you're feeling good for this. Let's kind of jump into the solutions here for addressing the estrogen dominant stuff in endometriosis and how we go about it from a holistic perspective. We've kind of broken it down, at least in our notes, Dr. Tim, to addressing cortisol, because we have this whole progesterone steal issue, which we'll talk about, liver detoxing, which if we could give some maybe brief recommendations of like, hey, consider doing this lifestyle wise, consider doing this, supplement wise. And then of course, gut health is a big one that we will usually find connected to some of these hormone imbalances. So we can talk about that a little bit. So yeah, Dr. Tim, I'll kind of open it up to you and we'll just kind of jump in together.
Yeah. So working through all this stuff, I guess the biggest thing that we really have to talk about is, at least for starters, and honestly, most women that are listening to this podcast, how do you go about fixing this right now? First things first, fix your blood sugar. So I would heavily encourage you to listen to one of our, first 2 episodes to really learn about how to fix blood sugar as best as you can. So, with, like you said, progesterone, steal, the cortisol shunt, all that stuff. Cholesterol is the backbone of all of our steroid hormones. So it goes cholesterol, and then it converts to pregnenolone, progesterone, and then from there, you'll then use that to produce cortisol, or you use that to produce something called androstenedione, which then is converted into either estrogen or testosterone. And so cortisol is pretty high up in that whole hierarchy. It's one of the first things that you'll produce. And because of that, if we experience some sort of chronic starvation issue or some sort of chronic stress, we're going to get where we shunt resources and steal progesterone from good estrogen, testosterone production to produce cortisol and perpetuate a stress response. If you're getting chased by a bear, or if you're starving, say you're a pilgrim and it's late winter, early spring, and food rations are running low, and you have to make it until everything blooms and spring rolls around. Do you think that your body's really going to care about being fertile or having regular periods?
Right.
I personally do not think that it's going to do that.
Right.
And it tends to hold pretty dang true. Your body just wants to live to fight another day. And if you are not in a thrival state, your body doesn't care about reproducing, and therefore you're not going to have regular cycles and all that stuff. So that's where the whole cortisol shunt, progesterone steal thing comes in. Rewind to when the estrogen dominance talk was happening about too many estrogens because you can't detoxify them. That is what I'm talking about that contributes to that depletion of resources due to sealing progesterone, pushing it towards cortisol instead of estrogens and other hormones. So we need to figure out why that's happening. Fix the blood sugar, handle underlying inflammatory drivers of stress, detoxify byproducts of infections and various toxic chemicals in the liver or that are in circulation that will inhibit liver detoxification. And then from there, replenish resources. So give your body lots of really B vitamins, methylated B vitamins, things like choline, glycine, zinc, magnesium, all things that are really, really good for helping with methylation. But then also, let's rewind to the 3 main hormone detox pathways in the liver. Glucuronidation, which artichoke extract is the best thing you can possibly do to support that, in my opinion. Chromium, magnesium, zinc are also on that list. Glutathione conjugation, just taking some glutathione or a lot of the cofactors that go into producing it. So glycine, vitamin B6 or pyridoxal 5-phosphate in its active form, super important. Magnesium, potassium, all those things are on the list that can really be helpful there. And then from there, the last hormone detox pathway is sulfation. So NAC, N-acetylcysteine, was a super popular one during COVID because of its antioxidant properties and its function to help produce glutathione. That one just helps detoxify hormones as well. So if you hit all of those things by, turning that faucet of hormone off, or at least to an appropriate level, by managing blood sugar and reducing chemical stress, inflammatory stress, you name it, and then start detoxifying the liver, a lot of the estrogen dominant symptoms are going to go away. So the super, super heavy bleeding, the cramping, shorter cycles, longer periods, a lot of that stuff will start to move in the right direction. But beyond that, say you have detoxified that, say your liver has resources to do so, that's where encouraging decent progesterone production can be helpful as well. And that's where we'll utilize things like ovarian glandular supplements that are essentially bovine or porcine ovary tissue to help rebuild your ovaries and help produce hormones. Vitamins like vitamin B2 or niacinamide, vitamin B3, those are all on the list to help produce progesterone and then, make its way towards estrogens, that stuff. But it's just all a factor of what you have going on. And usually with endometriosis, it's not a lack of ability to produce hormones, it's a lack of ability to detoxify them, as well as underlying inflammatory things that contribute to basically cells being distracted from extra tissue growth and letting all of this fibrotic scar type tissue creep in when all of the endometrial tissue kind of, infects everything else and grows outside of the uterus and causes problems. So that's when it comes to treating this in the office. That's probably the quick rundown that I'll give people is let's work on detoxifying things. And then from there we can work on in conjunction with that, work on dealing with inflammatory drivers and all that stuff. And once all those things have calmed down significantly, we can then get into ovarian glandular, or say we need to reinforce that, hypothalamic pituitary, gonadal axis, where we basically just need to get the brain and tell the ovaries to produce hormones again. That's where like pituitary tissue could be helpful, or other things like chaste tree or vitex berry, YM can be helpful. There's a lot of different herbs and remedies that you can do to help reinforce those pathways once you get to that point. Because if you try to encourage production when you need to detoxify it, it can lead to some problems. You don't want to add too much in when your body can't detoxify it. So last thing that we have on our list here is gut health. But Dr. Joel, why don't you walk us through how gut health will play into all this stuff and how that contributes?
Yeah, for sure. So I'll walk through that piece and then add a couple 2 cents, and then we'll kind of wrap up here. So one of the things that I find a lot when I'm muscle testing patients is we'll find, hey, there's some support needed with detoxing these hormones. There's maybe some toxins or other things that the body needs to detox, that it's increasing stress in the body, increasing cortisol. And then a lot of times it comes from estrogen dominance issues come from the gut health. So when it comes to the gut health, there's really 2 main things that we talk about with the gut health. Number 1 is infections, and then number 2 is food sensitivities or allergies. So number 1 with infections, you can have a bacterial imbalance or infection in the gut. You can have a fungal or candida imbalance or infection in the gut. You can have parasites infections in the gut. And if you have any gut issues, whether it's gas or bloating, abdominal pain, maybe your stomach just is kind of weak and you don't do well with certain foods and you just tend to be more sensitive, the chances that you have some kind of infection or imbalance there is probably 99.9%. And so usually what I find, and we talk about this all the time, but a lot of times I'll find parasites to be extremely common. But even with that, there's always some kind of bacterial or fungal imbalance right next to it. I would say if your main symptom is you just struggle with a ridiculous amount of bloating and gas, I would say you're probably more primarily dealing with some kind of a bacterial issue like SIBO, small intestine bacterial overgrowth, or SIFO, small intestine fungal overgrowth. 2 kind of labels that we'll use from time to time. But basically all they mean is, hey, the bacteria in your gut, whether it's the healthy bacteria or the bad bacteria, is overgrown. The fungus in your gut is overgrown. And that those fungus and bacteria, they give off all this gas. So to kind of bring it all back here, if you have estrogen issues, if you have estrogen dominance problems, hormone imbalances, most likely you have some kind of gut issues. And that, I make that conclusion because I see a lot of times that when we work on detoxing things and with the muscle testing, it usually goes back to some gut issues and infections and that kind of thing. Now, we've talked a lot about gut problems and gut issues in other episodes, so I won't get into it too much. But essentially, you want to figure out what herbs, specifically what infections you have, and then you want to get into what herbs are going to help with that issue. We love to jump into the muscle testing, figure out exactly what infections are there, bacteria, fungus, or parasites, and then jump into what herbs are going to be needed to fix the issue. You can do stool tests. You can do a functional stool test. It'll give you tons of information. What I find is it usually misses parasites. And even if you do a stool test and you get all the information, it doesn't necessarily tell you which herbs are actually going to help to fix those issues. It just kind of gives you a screenshot in time of what's going on there. So in general, I recommend if you have access to somebody that does muscle testing, specifically the systems healthcare technique, which Dr. Tim and I both do, we find great accuracy and just success with those things. Outside of the infections in the gut, food sensitivities or allergies are super common. Usually it's going to be related to gluten or dairy. Occasionally it could be related to other things like coffee or nightshades or something like that, but usually gluten and dairy. So what you would want to look at is, number 1, like if you have any gluten or you have any dairy, like how do you feel afterwards? How's your gut health? And then also, how is your mood and how are your hormones afterwards? Those are all very important. And then I think the last thing I'll mention about foods is foods that are high in what we call this acronym called FODMAPs. Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are all foods. These are all different like sugars that are found in a lot of times natural foods, garlic, onions, apples, mangoes, all these different foods, and they're high in FODMAPs. FODMAPs are going to feed bacteria and fungus, usually cause you to be more bloated, gassy, that kind of thing. And if you're eating a lot of those foods and you kind of react to them, it's probably because of an infection, not necessarily like a food sensitivity. So just want to differentiate some of that. All right. Dr. Tim, anything else that you want to add to the gut stuff? Otherwise, I'd love to add a couple more things to our cortisol topic and then maybe give some recommendations for things in general going forward and what people can start doing today.
Honestly, you pretty much hit it all. The only thing that I think would be somewhat necessary to mention is if you have sort of gut infection, make sure that you're dealing with the downstream effects or the downstream chemicals that are going to be produced as a byproduct of that. And that's acetaldehyde. So if you Google acetaldehyde, that is the chemical that alcohol breaks down into, and that is the hangover chemical. So it's what makes us feel like junk after we drink too much. And what will keep you jammed up at that acetaldehyde step in that biochemical detox pathway is a lack of cofactors that help the acetaldehyde dehydrogenase enzyme do its job. And so the cofactors that assist with that are vitamins B2 and B3, and then iron and molybdenum. However, B2 and iron can feed these infections in the gut. And so I really hesitate to encourage people to take those two things to help detox stuff, because you can inherently feed the microbiome issue where the acetaldehyde thing is preventing the body from dealing with that anyway. And so it can kind of just make this whole problem worse. So if you're going to, from home, start doing things, molybdenum or Mozyme from Biotics Research is what we go with. And then niacinamide. So get it from Pure Encapsulations or Thorne or some other reputable brand that would be native. But this kind of has like a kind of an overlap, because if you have too much acetaldehyde, it's going to downregulate your immune system and you're going to kill the microbes in the gut effectively, even if you're taking herbs, or you can temporarily kill them off, but you will remain susceptible to it and things will get thrown back. It happens almost every time. In addition to that, if you are producing this stuff and it's something that your liver is struggling to detoxify, there's going to be some sort of I guess as a whole, liver detox issue. And so you're going to have more difficulty regulating hormones and detoxifying hormones, all that stuff. And you can have estrogen dominant symptoms, even if estrogens aren't really the problem. It could be this acetaldehyde toxicity. So deal with that part too. But awesome. Anyway, into your spiel on cortisol and all that stuff.
No, that's good. Yeah. So you broke down a lot of great things with cortisol. One thing that I'll add here is cortisol, being that it can just totally wreck the hormones, it can steal progesterone. As your body's in that survival state, your body will take that progesterone, turn it into cortisol, and just worsen that estrogen dominance issue with progesterone decreasing more and more. Most of the time, Dr. Tim, when people talk about cortisol and stress, they first think like, oh, stress from work, stress from life. I would argue that's not even like, it's a big one, but I would argue it's most of the time it's not even the biggest one. I would say the biggest thing with cortisol is people's blood sugar issues, which we talk about all the time. And that goes back to, you need to be eating 3 meals a day, assuming you have appetite in the morning and that kind of thing. If you don't have appetite in the morning, that's a gut issue. That's a digestive issue. We got to fix some things there, but you should be able to have 3 meals a day, 4 to 5 hours in between, so that your food can process and then your body can go through a self-cleansing process in the gut, and then you'll be ready for more food. 3 meals a day, 4 to 5 hours apart, focusing primarily on protein. Focusing on protein and not getting too many carbs. And so how much protein is enough protein? I would say for most women in general, Dr. Tim, we talk about roughly 75 grams a day for women. Most of the time, some doctors recommend 100, but essentially what you're looking at is roughly 25 grams to 35 grams per meal protein. That's going to keep you full until your next meal. That's going to help balance your blood sugar. And as your blood sugar is balanced, your cortisol won't be spiking all over the place. Kind of a topic that we've talked about quite a bit in other episodes. Like you mentioned, the first episode, maybe the second episode. So I think definitely the second episode that we've done. So eating enough protein, 3 meals apart, no snacking, all of that is super important. Now, obviously, there's basics when it comes to health that helps your body in general, your health in general, and cortisol. Getting enough sleep, getting good sleep, getting movement, getting enough movement. You don't have to go work out hard every single day. If you just go on a walk for an hour a day, you can break it up into 30 minutes, whatever you do. spend more time outside. Like those things are so helpful and important when it comes to your body and your nervous system. I would say having a positive mindset, healthy thoughts is super important. If you are always putting yourself down, putting other people down around you, like that is going to be negative on your health. And so we've got the sleep, we've got the movement, we've got the nutrition, eating whole foods, not eating processed junk, actually having to cook your food rather than just kind of throw it in the microwave, getting fast food and all the restaurant food that has all the preservatives, all these processed foods, all these seed oils, eating whole foods, making your own meals. All of these things are super important when it comes to just overall health and things like that. Sometimes when Dr. Tim, people will hyper focus on the nutrition they'll hyper focus on the supplements and different health programs when in reality they need to focus on learning more about nutrition, eating better, getting better sleep. They need to focus on the small things. They go a really, really long way. So that's the cortisol piece. As far as liver detoxing, a couple nutrients I love that I find are super helpful is artichoke because it has that glucuronic acid in it. We use natural or AMG Naturals is the company we use for artichoke. I would say the next things I'll usually recommend is magnesium. Now there's 3 main types I see people test for, either magnesium calm, magnesium citrate, or glycinate from pure encapsulations. I would probably recommend magnesium calm first. And then, depending on things, you may need magnesium citrate from like a company like Pure Encapsulations or magnesium glycinate. But that's going to help in general with stress and cortisol, but also it's going to help with all these different hormone detox pathways. B6, like you mentioned, can be very helpful. We like biotics with that one. Zinc, especially zinc chelate from Standard Process, is great. I find that to be super helpful. And then methylfolate 5-MTHF from Thorne, we tend to find very helpful. In all of these things, though, Dr. Tim, one of the things that we emphasize, and I don't want to forget it in this episode, is you can generally learn more about all of these things through YouTube, through podcasts, all these things, and you can work on these things yourself. And you should be able to do that and find good improvements. Will it take you ultimately to full resolution of your issues? It can, but it can take a long time when you're doing it by yourself. And it can take a little bit of trial and error. A lot of times I'll recommend, if you want to work with a professional, get to the bottom of things as quick as possible, find someone that does obviously functional medicine, but even more specifically the systems healthcare technique like Dr. Tim or myself. And what you're going to do is you're going to save yourself a lot of time. It's going to cost some, of course, for appointments and all these things, but you're going to save yourself a lot of time and a lot of frustration. And then, of course, just work to get to the bottom of things more efficiently and so forth. So, Dr. Tim, I know that was fast. That was a lot. Thanks for bearing with me. Any last thoughts here? Otherwise, let's go ahead and wrap up.
Let's just wrap it up. It's always a lot of information, but whenever we get into topics where you feel like we've kind of just brushed over it, like blood sugar or things, it's always because we have other podcasts that we talk about it like crazy. So if you have questions about what we mean by, okay, we'll fix your gut, do these herbs, do this, that, and what really goes into identifying and fixing those problems, podcasts that are dedicated to those things. And so I heavily encourage you guys scroll through and just, while you're working out or while you're driving to work and home, do a little bit of light listening to our other podcast to kind of put those pieces together. If we talked about everything on the podcast, it would just end up being just way too long.
Hours and hours. So, it's already long enough.
Yeah, exactly. But yeah, I heavily encourage you guys to do that. And also, like we always say, if you guys have any input on future episodes that we haven't really covered yet, that would be great if you could share that with us. So with that being said, how can you share that with us? How do you find us? So let's go through that and kind of sign off here. Dr. Joel, why don't you start us off?
Yep. So Dr. Joel Miller, the practice here is in Flower Mound, Texas. It's called Freedom Health and Wellness. You can find me online at drjoelmiller.com. You can find our office number. You can give us a call or shoot us texts. If you have questions on things, you can find me on Instagram and reach me there as well. It's drjoelmiller on Instagram. Should be fairly easy to find. So yeah, if you guys have any questions, need direction, need some guidance, reach out. We'd be happy to help.
And I'm Dr. Tim Augustiniak down here in Bentonville, Arkansas at Flourish Functional Wellness Center. If you want to find me online, that website is draugustiniak.com. That's DRAUGUSTYNIAK.com. On there, I have links to all the socials as well as all the contact info for the office. So like I said, if you guys have any questions, comments, concerns, or suggestions for future episodes, feel free to reach out and let us know. Thanks everybody for listening, and see you next time for episode 80.